I'm Tanya Siddiqi, hematologist at City of Hope Cancer Center in Southern California. I'll discuss the TRANSCEND CLL 004 study briefly. So this was a phase 1/2 trial among relapsed refractory CLL patients, chronic lymphocytic leukemia patients, who had all had prior BTK inhibitor therapy, and a total of 2 or 3 different lines of therapies before they could be eligible for this trial with relapsed disease. We enrolled over 100 patients and treated them with Liso-Cel CAR T cells, which is a type of CD19 directed CAR T cell product that gives patients CD8 positive and CD4 positive CAR T cells in a 1-to-1 fashion. Among the 100 plus patients that we treated, 118 patients to be exact, there were a majority of patients, almost 70% patients, who had failed not just prior BTK inhibitor therapy, but also venetoclax, which is a BCL2 inhibitor. And so those are the best 2 treatment options in CLL patients at this point. And so once patients have failed those 2 lines of therapy, then options are more and more limited. These were particularly difficult to treat patient population, if you will. And among those patients, 80 or so patients who had failed both BTK inhibitor therapy and venetoclax, we saw pretty excellent remission responses, which means that about 30 days after they received their CAR T cells, 20% patients had achieved a complete remission where no disease was detectable, and they were all also undetectable MRD, minimal residual disease, was also negative on their bone marrows and peripheral blood in the vast majority of these patients, almost 100% to be exact. And among all the other patients who maybe had not failed venetoclax yet, but had all obviously passed through BTK inhibitor therapy, the complete remission rate was fairly similar as well. And the overall response rates were about 45% or so in this patient population. If we looked at progression-free survival and duration of treatments, duration of response in these responding patients, and found that for the complete responders, median progression-free survival and therefore overall survival had not been reached at the 2-year follow-up, median follow-up time point. And even in the partial remission patients, we found that the median duration of response, was fairly respectable. Median progression-free survival was in the realm of about almost 3 years, 20-some months, 27 months, I believe it was, which in our minds is a very respectable number, given these patients had gone through a median of 5 prior lines of therapy, and to get 1 shot of CAR T cell treatment and then go, a couple of years without needing any therapy again is a really good thing for these patients without having to be on continuous pills or injections or infusions, and dealing with the chronic side effects. So we think that in the patients who respond, the CAR T cell Liso-Cel has worked really well. And these patients, in fact, all the patients who received Liso-Cel on this trial did fairly well. There were very few patients who had high-grade cytokine release syndrome side effect and neurotoxicity type side effects. These are side effects that we already know how to deal with in terms of CAR T known toxicities, and there was really nothing unknown or new that popped up in this group of patients as far as CAR T cell therapy is concerned. So all in all, we were very happy with the results that these patients with multiply relapsed CLL got good benefit for. 20% complete remissions have not been seen in relapsing CLL patients or multiply relapsing CLL patients. It sounds like a low number, but it really is a very good number in my mind. And I think our next work that'll be coming out of this work will try to look and identify patients where we can get even higher numbers of complete responders, because it seems those are the ones who are not relapsing for multiple years of follow-up thus far, although we still have a long way to go in terms of following them over a long period of time. And really happy to see last night that the FDA approved this CAR T product as the first and only CAR T cell product in relapsed refractory CLL and SLL patients. So this is a very good day for our CLL patients who have participated in the trial and others who have hope from this new treatment modality available to them now commercially as well. So the goal of our future research will have to look into things like how can we treat patients maybe earlier, especially patients who have high-risk disease, so that we don't have to wait for 5 lines of therapy before we give them CAR T cells, but maybe even sooner. That would be one line of investigation from my personal interest standpoint. I think other things will be reviewed now that we'll have Liso-Cel commercially available. I think there'll be a lot of other ideas that come up, whether it's combinations or bridging or how to take this potentially life-changing therapy to more and more people with relapsed CLL disease, essentially, like we've done for aggressive lymphomas already. We've started treating them sooner and sooner, which is great. I always like to end by saying, like, hey, it's always good for physicians and patients to kind of seek out clinical trials and help us advance research by coming to centers like ours in order to be on clinical trials, or even now that we have very specialized Liso-Cel CAR T cells available for multiple diseases, including now CLL, that physicians should consider referring early so that maybe this one-time treatment can help protect their patients from multiple years of chronic therapies for a long, long time.